Well, as you know, most of the videos that I present in this channel are actually guiding you to stay cavity free so that you don't need to have extraction of your teeth done. However, I also acknowledge that for some reason you might actually need this extraction. So today I want to give you tips of how you can ensure that this wound heals in time and doesn't take longer than usual. Usually after an extraction, there are things that you should expect. Things like pain and swelling. Those ones are normal reactions of the body and they are easily manageable by simple painkillers and a few instructions. For the purposes of ensuring that your wound heals quickly and on time without causing you further complications, these are the tips that you should actually follow. Because if you follow this, then your wound will heal as soon as possible. The first thing is that usually after an extraction, we immediately pack the wound with cotton or gauze. And the advice is that you should bite on it. So this gauze should be kept in position by biting for at least 1 hour. Though 2 to 3 hours is the ideal, but at least 1 hour. This will ensure that the area receives enough pressure to stop the bleeding. But also, this ensures that the blood that would have otherwise come out settles in the wound and forms a clot. That clot is very essential in the healing of the wound. Without it, the wound will remain open and will take too long to heal, and in the process causing you too much pain. The second thing you want to do is to avoid spitting. Please don't spit immediately after extraction or for the next 24 hours. Spitting encourages the bleeding to continue, and for as long as this bleeding is continuing, the clot will not form. That goes hand in hand with rinsing. Rinsing of the mouth should not be done for at least 24 hours after extraction, because rinsing will wash out the clot from the wound that would have otherwise encouraged your wound to heal. Number 3. In order to avoid an exaggerated swelling from forming in the area of your extraction, it is advisable that you take an ice bag, you wrap it in a cloth and apply to the area where the extraction has been done. This will ensure that the swelling that forms is not too big to cause you inconvenience. And it might actually eliminate the swelling altogether. So what you do is to take that ice bag and apply for 10 minutes. Then leave it for some time, 20 to 30 minutes, and then apply for another 10 minutes. If you do that 4 to 5 times within the first 24 hours, then there are higher chances that the swelling will not develop and your healing will progress normally. Number 4, you should avoid activity for the first 24 hours. Any activity that is going to increase your heart rate, that is going to double your heart rate, increases your chances of bleeding afresh. And as I've said earlier, this continuous bleeding is not desirable and it works against the healing of the wound. So please take a rest at least for the first 24 hours to enable that clot to form and your healing process to start well. Number 5, should you have anything to drink, please do not use a straw. A straw is going to apply pressure on your cheeks, and that means that it's also applying pressure at the area of extraction. And this pressure is going to encourage the bleeding of your wound. And this bleeding is what we don't want on teeth, because we need the clot to form so that this wound starts healing normally. In addition to that, the pressure that you apply when you're using a straw or drinking also has the potential to suck out the clot that would have otherwise formed in the wound, and this will leave the wound open and it will dry up, and this will significantly prolong your healing period. Then after 24 hours, you should start rinsing with warm salt water. The warmth should be almost equivalent to the same temperature of the tea that you are comfortable drinking. That is the useful temperature. Not so lukewarm to the point that you don't feel the warmth when you gargle, and not too hot to burn you, but within the temperature you are comfortable with, the temperature which is almost equal to that of the tea that you are comfortable taking. The salt in the water will act as an antibacterial that is going to reduce the bacteria that would have otherwise caused your wound healing to delay, and it will promote the healing. The temperature of the water encourages blood flow in that area. After 24 hours, when you are not worried about bleeding anymore, the normal blood flow will be restored in that area, and that will bring nutrients which are relevant for the healing of the wound. So make sure after 24 hours you start rinsing with warm salty water to encourage the healing of the wound. Number 7, if you are a smoker, please put away the smoking for at least the period in which you are expecting the wound to heal. Because it's a well-known fact that cigarettes contain nicotine, and nicotine is against wound healing, most especially in the mouth. And for this particular case, for your extraction wound, if you continue with the smoking, then your wound healing is likely to delay beyond the expected. So please put away the smoking and let the wound heal. Then maybe if you feel like continuing, you may continue your smoking, even though I don't encourage that. Number 8, avoid touching the wound. Touching the wound will do 2 things. 1, it might introduce bacteria from your hands to the wound. As you know, every body part has its own bacteria. Useful bacteria in one area is harmful in another. Useful bacteria on the skin of your hand is harmful in the wound of the mouth. So if you touch, you are transferring bacteria from your hands to your wound in the mouth, and that is going to delay the healing of your wound. But in addition to that, touching your wound is going to remove the soft layers which are trying to form to close your wound up. That means that instead of the wound closing up quickly, it's going to take too long, and this in turn is going to cause you other complications. So please avoid touching your wound, and in addition to that, do not pass there your tongue, because passing the tongue there will also wipe out all the layers which are trying to grow to heal your wound, just the same as touching, and that will delay the healing of your wound. Number 9, after extraction, make sure that when you go to sleep, you do not lie flat. Lying flat will encourage blood to rush to your head, and that can lead to bleeding at night. And that is the reason why most people actually experience bleeding at night after extraction. What you should do instead is to make the use of pillows to raise your head to an elevated position. This will ensure that blood does not rush to your head and cause your wound to bleed. Finally, ensure that you keep good oral hygiene. Continue with your brushing and flossing, but do not brush the area of the wound. If you suspect that some food has entered your wound area, just get warm salt water and gargle and wash out those small food particles, but do not brush the wound. If you do all this, then your wound should be able to heal in time, and you will not experience all the complications associated with delayed healing of the wound. If you have any other concerns and questions, please leave them under the comment section and I will answer you. See you in the next video.